Healthy Communities That Care of Livingston County was founded in 2002. Serves the approximately 65,000 members of our county. Our community has 8 school districts, and most of the communities are rural. In 2003, we began addressing underage drinking. And while we had a lot of great quantitative data from our community assessment on lifetime and past 30-day use, alcohol-related arrests and injuries, and other archival data, but we knew we needed to talk to our youth to get the real narrative behind the numbers associated with their access to alcohol. We wanted to know how, when, where, and with whom they were using alcohol. We also needed to be able to tease apart the biggest priorities for our coalition, given that we're serving 17 towns and 9 villages. We knew that while some of the conditions associated with youth access to alcohol were countywide, others were unique and existed within smaller geographic boundaries. Since we're in such close proximity to the State University of New York and Geneseo, we decided to leverage this great resource and build our capacity to collect good qualitative data. As it turned out, students were in need of a hands-on experience in conducting focus groups. So really, for the coalition and the university, it was a win-win situation. With the university on board, we approached our middle and high schools to develop a plan to work collaboratively. That was in 2004, and since that time we've been conducting focus groups with over 400 middle and high school students annually. In addition to helping us collect the data, SUNY Geneseo students have been very helpful in data analysis and reporting. It's been so extremely beneficial for ensuring that our coalition is making data-driven decisions. Because of this data collection effort, we were able to identify needs in specific parts of the county. For example, in the college town of Geneseo, we found that high school students, not surprisingly, were attending college parties. The high school students were also telling us that they could get alcohol at the local bars and retailers, either by getting somebody to buy it for them, or because they knew one of the bartenders or clerks. Retailers were implementing some strategies to prevent underage purchases, but there was still a lot of work to be done. We're fortunate to have a wonderful partner in our college coalition, and together we implemented compliance checks, fake ID details, and responsible beverage server training. In addition, we provided campaigns for students about local and state laws regarding alcohol. Today we're seeing positive changes in the college town, such as fewer bars out of compliance, fewer fake IDs being confiscated, and an increased awareness of alcohol-related laws. In addition, Geneseo is the first village in our county to implement the social host ordinance. We implemented a county-wide media campaign to educate adults about the risks and consequences of providing alcohol to underage youth, and not keeping track of the alcohol stored in their home. What's unique about our work is that we utilize mandatory sports meetings with parents, coaches, and students, and report card mailings through schools to get this information out. We also collect data from parents at the sports meetings. Fact sheets are distributed in health classes at high schools, and the college parent orientation at the college now includes a handbook on talking with college-age students about alcohol. I really think the most effective part of our coalition's work is that we're bringing together the different community sectors and agency partners to address the needs of our county. We're recognized in our county for bringing this valuable data analysis, planning, implementation, and evaluation that keeps us on track and moving together rather than in silos. We're seeing positive outcomes in our community as a result of our work and that of our partners.